Dr. Norrell, thank you so much for coming to Thrombosis Canada to help us build awareness on cancer patients concerning blood clots.
Thank you very much for having me. It's a privilege. Really cool to be here. Great to meet people in Canada who are as passionate about patient care as I am.
Amazing. Dr. Norrell, can you tell us a little bit about yourself and your expertise?
Yeah. First thing I'd say about myself is I prefer you to call me Simon.
Okay.
We're on the same side here. We're all doing the same thing. What is there to tell? I'm a palliative care physician, so I do supportive care for people with advanced cancer and advanced non-malignant disease.
Okay.
And what I found was many of my patients had blood clots, especially those with cancer. And over the years, I've developed that as an interest, both clinically and with research.
What is cancer-associated thrombosis and what are the concerns with healthcare?
Well, I know as a patient who's experienced venous thromboembolism, you know a lot about blood clots.
Absolutely.
And this is pretty much the same thing, but it is something which happens when people have cancer.
Okay.
Why is it serious? Well, for all the same reasons as someone who has a blood clot without cancer, that it can cause pain, it can cause discomfort, and untreated, it can sadly kill you.
Can you tell us why certain cancer patients are prone to clotting? Are there health risks for some versus others?
Absolutely. I think all cancer patients have an increased risk of blood clots compared to the general population.
Yeah.
And that's primarily because the tumour releases molecules into the blood which can make the blood more sticky.
Okay.
But not all cancers are the same. We will find that someone with cancer of the brain, of the pancreas, of the lung, of the ovaries, their blood is more sticky than someone with breast cancer or prostate cancer. But it's not just the type of cancer, it's the stage. So if you have a cancer that has spread to other parts of the body, and we call that metastases, that can increase the risk of blood clots 19-fold. Then, if we add in treatments like chemotherapy, that will increase the risk further. So if I illustrate it, someone with breast cancer, which may not be a particularly thrombotic or clotty condition, if you have someone who's had early stage breast cancer, no spread of tumour, and they're having no chemotherapy, the risk of blood clots is 0.2%. But if you give them curative chemotherapy, the risk goes up tenfold to 2%. In that same group of patients, if they had metastases, so the cancer is spread and you gave them chemotherapy, the risk was 8%.
Wow. What do patients need to know about recognizing the signs and symptoms of blood clots with cancer?
Well, I think the first most important thing is that if you recognise blood clots early, you can treat them early, you can reduce long-term complications, you can improve symptoms, reduce death. So the symptoms to look out for are the same as the symptoms of anyone who doesn't have cancer. Leg swelling, pain, tenderness of the leg, breathlessness, chest pain, collapse. The difference is that those symptoms are common in anyone who has cancer.
Yeah.
You may get breathlessness because you're anemic, or you have a chest infection, or you have some fluid on the lung. You may have a swelling of the leg because the lymph nodes are pushing on flow of fluid, or because you have a low protein in your blood. So there's lots of reasons. So people often just put off, this can't be anything serious. This just happens because I have cancer or I have chemotherapy. And I think we have to have a low threshold for questioning, is this breathlessness due to something very simple and straightforward, or could it be due to a blood clot?
So generally, what is the standard treating cancer-associated thrombosis?
Well, cancer-associated thrombosis is actually a different beast to thrombosis in non-cancer patients.
Okay.
We know that these patients have a higher risk of getting recurrent blood clots, and data has also shown that patients, when they were originally treated with oral medicines such as warfarin, had an increased risk of bleeding.
Mm-hmm.
So rather than using oral agents to treat, we actually use a group of drugs called low molecular weight heparins.
Yep.
They're an injectable anticoagulant. And we found from studies that the rate of blood clot recurrence is halved. There are other benefits as well. These medicines do not interact with chemotherapy, so you can carry on having your treatment. It's not going to interfere with your cancer treatment. So that's very important. For people where absorption of drugs are a concern, or you're feeling too sick to hold your medicines down, the fact that it's getting injected, you know it's working. But the bottom line is that these drugs have been shown to work better than the current standard we give to non-cancer patients.
So I understand that your focus on cancer-related thrombosis and your research has been to understand the gaps, if there are any, concerning the healthcare for these patients.
Yeah, we've been doing a series of studies called Pelican, which stands for Patient Experience of Living with Cancer-Associated Thrombosis. And the thing that led to this, believe it or not, was that 19 years ago I was a cancer patient and I received treatment for cancer. I was cured, thank goodness. But what I recognised was that as a patient, things that were important to me may not necessarily have been important to the doctor.
Absolutely. And do you find that there's a culture change? For myself, I've had blood clots for 20 years.
Yeah.
Back then they gave me a little pamphlet with this nice little drawing of a blood clot and what it was. But now the information available is so vast. You know, do you find patients are really becoming their own ambassadors, advocating for themselves, and finding this information safely and quickly?
I think you're absolutely right. Patients are the ambassador for this. And not only that, I believe that healthcare professionals are getting so much better at recognising the value that patients can bring to improving healthcare for other people.
What would you say are the top 3 questions cancer patients can take to their healthcare teams in order to get the best results and the best answers right away?
I think the best way for cancer patients to get information to prevent blood clots, I think number 1, say to your healthcare professionals, what is my risk of getting blood clots on this cancer treatment? Number 2, what should I be looking out for which may suggest I have a blood clot? And number 3, if I'm worried that I may have a blood clot, who should I contact?
Simon, on behalf of Thrombosis Canada, we want to personally thank you for coming out, taking time in your busy schedule to apprise us on the situation with cancer patients and thrombosis. Thank you so much.
Martin, it's been a privilege and a pleasure, and I just want to say that the work that Thrombosis Canada is doing is great. I think it's going to have a direct positive impact on patient care, and I really hope we get to work together again in the future.
Absolutely. Thank you so much.
Cheers, mate.